Hi, I'm Stephanie Shelton, and this is Conversations on Health, How We Get There. Most of us have had some experience with the mish-mosh of healthcare in the United States, which substitutes for a real healthcare system. It's the kind you learned about in episodes 1 and 2. From the patient side, you met multiple amputee Steve Fisher, who lives in Prague, the Czech Republic. He's been there for 30 years, and he's very grateful for the extensive and extended care he automatically received after he and his employer dutifully paid into the Czech healthcare system for 30 years, as all working Czech residents must do. But here in the United States, not so simple. If you've had to navigate the maze of doctors and hospitals and healthcare alliances and insurance in the U.S., you probably have a horror story, like my friend Pam Cookson.
As a young person, most of my life I've been extremely healthy. I also worked at a very prestigious company that had excellent insurance. So we had the same doctor in Indiana for over 30 years. He was wonderful. He knew us. It was easy to go to him. So I had excellent care while I was in Indiana, and that changed when I came to St. Augustine, Florida.
And I think maybe you had that excellent care because you had one doctor in Indiana.
That is 100% correct.
And then so all the systems kind of fell in behind that person.
Mm-hmm. He would give me referrals, but they were referrals that he was sure of. So I always had the best of care.
And then you came here. What happened? I mean, have you been to a doctor aside from this one incident?
Yes, I started right away to try and find a new family physician. And I've been here in St. Augustine for 8 years, and I've had 6 family doctors because of different incidents with the doctors. And when I say incident, I mean that they're moving, quitting practice, being fired. So I'm on my 6th one.
That does not give you a great deal of confidence that your latest doctor knows anything about you.
And that is correct. Of those 6 doctors that I've had, only one asked me to get previous records, and that particular doctor moved back to New York. So the doctors that have seen me here in St. Augustine don't know anything about my previous health records.
A lot of the older people who come to St. Augustine, and to Florida for that matter, come from other places and come with some needs for a doctor of some kind or another, some kind of medical services. From talking to your friends and just kind of observing, would you say that what happened to you, that many doctors in 8 years, is anything that's typical?
Yes, I've talked to my sister who lives in Daytona, Florida. And of course, she was born and raised in Indiana along with me. And she's had the very same experience, that we've gone through so many doctors, and we question the diagnosis. It just seems to us to be so fly-by-night kind of business.
That's really unbelievable.
Mm.
Fast forward now to the incident you told me about. You basically said to me, which is why I'm talking to you, the system failed me, in your text message.
Yes.
Why?
Yes.
Why do you say that?
I haven't had a bladder infection for a long time. And when I got the latest one, and this was over the 4th of July, it was a very serious infection. So the first place I went to, I tried to get in at an urgent care. And because it was Saturday before the holiday, there was not one urgent care facility open in all of St. Augustine. So I went to CVS and I was going to ask, and the pharmacist told me right away. He said, the only place that you can go to is the emergency room. Nothing else is open.
And the emergency room, meaning the emergency room at Flagler Hospital.
Yes, I went to Flagler Hospital. I was greeted by two police that were patting us down and looking through our purses. I waited 4 hours to be called back to be seen by a doctor. And then I waited another hour for a diagnosis, and it indeed was a bladder infection. So I was there for 5 hours.
And then what?
They gave me a prescription, and when I got the bill from the hospital, it was $6,000 for a bladder infection.
This is like, one of those movies that you say, it couldn't be fiction, or it could be fiction. Just to talk about medical systems per se, you have Medicare?
I have two insurances. I have Medicare as primary, and Blue Cross Blue Shield Anthem is my secondary.
So you are as covered as any one of us older people would be?
Yes.
$6,000.
Mm-hmm. Mm-hmm.
So, okay, you go home, you take your pills, and then what?
My symptoms cleared up in about 2 or 3 days, but I, of course, completed the medication. I called my doctor's office, and of course, all the medicine and records were forwarded from the emergency room to the doctor. And when I tried to get in, they wanted to get me in 2 weeks from the day that I called. So I kind of refused that. I told the office girl that I wanted to be seen before that. And they did not let me see the doctor. They allowed me to come in and have a test to make sure the infection was cleared up. It was not. They put me on another antibiotic, and I took that for another 7 days.
And that's all without going back to see the doctor?
Yes, that I had not seen my family doctor.
Did a nurse practitioner or somebody at least above the level of a office nurse see you?
I think it was just an office girl.
Pam's experience trying to get a simple bladder infection treated, something many of us have had to do, is eye-opening, and may sum up a great deal of what is wrong with the U.S. healthcare system. St. Augustine is the oldest city in the U.S. It attracts hordes of tourists and wintering northerners. Technically, it's a small city, but it has a good-sized hospital known for its cardiac care.
I was doing fairly well until about 3 weeks ago, and I woke up, it was Saturday during the night, and I knew right away I had another severe bladder infection. I knew that I was not going to go to Flagler emergency room, but I also knew that there was probably no medical help was available unless I went to an urgent care. So I traveled all the way to St. John to the urgent care facility. It's called Ascension St. Vincent.
And that, when you say you traveled all the way, how far is that from where you live?
About 20 miles.
That hurting all the way.
Yeah, it's a hard trip with a bladder infection. Yeah. When I got there, there was a sign on the door. They had changed their hours, and they were not open until 9 o'clock in the morning, and it was 6 o'clock in the morning. So I quickly went to the hospital there, and it also was Ascension St. Vincent. It was about 5 miles from the urgent care, and I got good care at that emergency room. I was the only patient in there at 5 o'clock in the morning.
Well, that was actually lucky.
Yes, it was, Stephanie.
Yeah. So at this point, that's where it stands? I mean, are you still on the antibiotics for this one? Or?
Another thing that really concerned me, I took the antibiotic. I did get in to see my family doctor this time. And I told her about all the trouble that I was having getting medical care when I needed it over the weekend. You can't predict these infections. And I asked her if I could have a prescription to keep with me at my home, that if I got another bladder infection over the weekend, I could just go and have the prescription filled, and she refused to give it to me. She said that there's always urgent care or emergency rooms available to me, which is another enormous bill.
Did she indicate that that it was illegal to give you that prescription, or just that, you should treat each incident as a new incident and go to an emergency room?
I know that if I was back home in Indiana, that I would have got that prescription with no questions asked. But I don't think she knows me very well yet. I've only been with her practice a year. And for some reason, she just was not comfortable giving me a prescription. Even though she has all the records, the hospitals, they don't just say I have a bladder infection, it's severe. She has that, but for some reason.
You're very calm about this now. Mm-hmm. You weren't so calm when you told us before. Mm-hmm. I'm just wondering how this leaves you feeling about the medical system. Well, certainly here.
I tried to think that through, Stephanie. Yes, I was very upset, and I still am. I feel very unprotected that when I get sick, there's no place for me to go, even highly insured like I am. The other problem, I understand that the nurses have been overworked and are tired. A lot of times they're grumpy. And then the staff that they have manning the phones or making appointments, they're very young and immature, and I just think it's a whole world of bad setup. I am upset about it.
But have you read, when you look at the local news down here, have there been stories about nurses quitting or doctors quitting? Because up north, there have been a lot of stories about people are just walking out. They've had it, they're burnt out, and they quit the profession. And it's caused a huge nursing shortage and to some extent a doctor shortage.
And I just read an article yesterday, as a matter of fact. It was in one of my newspapers. I take several of them. It was a nurse that had been a nurse for 30 years and really knew what she was doing. And because of the system, had quit and now was just helping homebound people just on her own. So there's a lot of that, I think.
Yeah, I'm sure things were just as bad everywhere. So seems to be countrywide that you're going to find, and not just our country, other countries. The UK, all of that, same problem. Of all of this, and if the bladder infections continue, or if you have anything else that happens to you, what if you fall and break an arm, standard kind of stuff. Is there like now a little wall in your head saying, I'm going to be given the runaround again, I don't trust the system, I don't feel comfortable going into an emergency room or to my own doctor, I don't know what to expect?
Yes, very definitely. I'm 77 years old. I'll soon be 78. And at my age, I'll probably use the medical system more than when I was a young person. And it scares me to see what I have been through with just a bladder infection. If I were to really have a serious illness, I would be scared to death.
So you went into the situation with some confidence in the system, but not a lot because you'd had so many family doctors. Mm-hmm. And you're coming out with basically none?
Correct, honey. That's correct.
And
it's a bad spot.
And you're insured, and you're smart, and you know your way around. Mm-hmm. Can you imagine what it must be like to be in a inner city kind of situation where you maybe have never been to a family doctor and something happens?
I thought of that. When I was in the emergency room, a girl, this was at Flagler, a girl came in and she was in the process of losing the baby. She was in a lot of pain and she had to sit in that waiting room with the rest of us. I saw so many, it was packed. It was just really crowded. And I felt sorry for a lot of those kind of people, honey.
Do you think if there were more regulations, either federal or state or local, that it would keep some of this kind of chaotic thing from happening? Like if somebody is an intern, which means that person's still in the university, yes, and going to go to the hospital that gives him his first residency for the most money when he graduates. Do you think there should be some rules that say this person can't be used as a doctor? Yeah. He can go along with a doctor or she can go along with a doctor, but if that person isn't going to be part of the hospital staff in a few months, because to have made you redo things is, not only is it difficult for you, but it's extremely costly for the overall system.
Yes, this happened at Mayo Clinic.
The prestigious Mayo Clinic began in Rochester, Minnesota, but it now has campuses across the U.S. and elsewhere. Pam went to the Mayo Clinic in Jacksonville, Florida. That's about a 45-minute drive from St. Augustine. The Mayo Clinic has been in Jacksonville for 30 years.
I went to Mayo Clinic because my kidneys were slowing down. And they gave me a battery of tests, a lot of them, including a sonogram. And I did not realize that the person that I was seeing was what they termed fellow, was not a doctor. And then when I went back the second time to get the results and talk to what I thought was a doctor, he was no longer there. He graduated and got a job in a hospital. And I started all over again with a whole new battery of tests that my insurance paid for again.
And why weren't the first tests just simply put into the system?
I am amazed by that also, Stephanie. I can't answer that question.
So they were basically lost, or went with him, whatever.
Whatever.
But they were never put into what should be. Now we have these connected patient systems. Everything is in an app or online, and they were apparently never put into it.
At the Mayo Clinic, the only bright spot that I found, it took me 2 months to get in to see her, but I was granted a visit with a dietitian. She was just excellent. She was so patient. She took so much time and made sure that I understood exactly what she was telling me. And she was on the other side of this system where she wasn't trying to help me with a symptom. She was actually trying to get me on the side of improving my own health by healthy habits and things that I was not aware of. She was excellent.
So, looking back on these two experiences, what came out of that? What made you the most angry?
The most angry was the first bladder infection I had, that there absolutely was no health care available to me except for an emergency room that I considered dirty, understaffed and poorly staffed.
And in terms of thinking about how much we all pay with insurance
Yes.
for health care, what do you think about things like repeating blood tests and even the fact that if your doctor keeps leaving, you have to explain some of the same stuff, even if it's written down. It's not the complete you, and you have to explain it again and again and again and take up time.
Yes.
And money on your side.
Yes, exactly. The first bladder infection at Flagler Hospital again, when I was taken back, I expected them to give me a urine analysis so that they could see that it was indeed a bladder infection, but they also drew blood that was a completely useless test. The second time I went to the emergency room at Ascension St. Vincent, they simply gave me the urine analysis and there was no blood work done. You have no control over what the physician orders at that time. You're at their mercy because you want those pills to take that infection away.
And even if you have insurance that pays for the bulk of what you're having done,
yes,
you still have a copay.
Yes.
You might be in the deductible period. Mm-hmm. So every visit is still, even if it's $20 in terms of what you have to pay, or $10, if you're on a fixed budget, that can be a lot of money.
Yes. Money definitely was secondary. When you're in a lot of pain, you would do almost anything for that to be over. And there was a whole room full of people that were really hurting that day. I'll never forget that experience. It has definitely colored me for life.
If you were king for a day, or queen for a day, and you could change our healthcare system, just given on your own experience as a patient, what would you, I mean, these are macro changes, what would you change?
The very first thing that I would change is the phone system. When I had that first bladder infection, I tried to reach my family doctor. This was on a Saturday, and they had changed their phone system, and the automated phone system kept telling me that she was not a doctor at their establishment. When they changed the phone system, they forgot to tell their patients that they changed the number. There is no relationship between the patient and the doctor anymore. And that is so valuable, that your doctor knows who you are when you walk in the door. We need more nurses, that's for sure. I don't know if they need a raise in their pay, or definitely the whole field of nursing is in trouble, I feel. And I don't know how they screen. I have an idea that the staff that they use in their offices are very low paid people, and they're getting exactly what they're paying for, and the patients are the ones that are feeling the pain from that.
So it's money and perhaps organization together that might fix some of this. Do you get any sense, because up north certainly we have a bunch of doctors who have grouped together in small group systems. We have hospitals that have grouped together in bigger or smaller systems. A lot of one-day surgeries are done at surgical centers that a group of doctors own or a company owns. There isn't this kind of certainty, well, I'm going to go to the hospital, I'm going to have my surgery, and I'll walk out the end of the day, but I know I'm in the hospital. I know my doctors. I can kind of process it through my brain. It's like each time you do anything, it's a whole new experience.
Very much so, Stephanie. When I would go to the doctor in Indiana, even if he had to refer me to somebody else, they were networking with each other. They knew each other. The imaging centers, the hospitals, pharmacies, it was a complete service that you received. I get the feeling here in Florida, one arm does not know what the other arm is doing.
And I imagine it's probably true elsewhere if it's true here.
Yes, I bet you're right.
Okay, so a final question, and this is kind of going over some of what we've already done. What kind of advice would you give to someone who's just moving down here? In your situation, you know, an older person who is reasonably healthy, but at some point is going to need something from the medical system.
When I was coming down to St. Augustine, my family doctor in Indiana told me, he said, Pam, he said, ask your girlfriends when they go to their doctor if you can go to the visit with them. And if you feel comfortable in the office, and if they allow you to go in with them, try and find a good doctor and a comfortable office that way. That did not work for me. That didn't. I think it's extremely hard. I think we're overpopulated here in Florida. I think that there's a lot of movement in and out of Florida. The only thing I would say to a newcomer, I would advise them that they're going to have trouble, to be wise and prudent when they're hiring a doctor.
Okay, thank you.
Yeah.
Thanks very much, Pam.
You're welcome.
There's no direct comparison, of course, between my two friends that you've met in this podcast, Steve living in Prague in the Czech Republic, and Pam here in the United States. Different healthcare systems, different needs. And you might just call it a slice of healthcare life in different countries. Plus, there's another caveat. Pam's more recent problems in a small Florida city may be partially because since the pandemic began in early 2020, as many as 200,000 U.S. healthcare workers have just quit their jobs or left the profession completely. Forbes also reports that almost half of those remaining plan to quit by 2025. Globally, about a third want out. In the next episode, we'll talk more about the supposedly integrated U.S. healthcare system, which Pam Cookson feels failed her so badly, even at the prestigious Mayo Clinic. I'm aiming for one new podcast a month, so look for the next one in mid-December. And please do subscribe to the podcast on Apple, Google, and TuneIn, on the Podbeam app, on YouTube for video version, and beyond. I'm Stephanie Shelton, and until I see you again, please do take care of yourself and those you love. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.